Namaste. Welcome everyone. Happy long weekend. Happy 4th of July. Happy full moon day. Today we also have lunar eclipse going on. All right. So today we are going to talk about yoga therapy for digestive health, for our gastrointestinal health. So, we say you are what you eat. Nah. In yoga, we say you are what you digest. So, digestion is the main thing. We can eat a lot of health food, but if we are not able to digest it, then it does our body little good. On the other hand, you can be eating ice cream and French fries and all fried food, and if you're able to digest it, that is the difference between a strong digestion and a weak digestion. So if you have experienced bloating, bloating, flatulence, heartburn, belching, nausea, burping, these are all symptoms of indigestion. And we know how we feel. We feel heavy, we feel lethargic, we feel anxiety, we feel discomfort, or sometimes there is just restlessness. It's not a very pleasant feeling. So there are a number of things that trigger it. Stress is one factor, of course. Overeating could be it, hyperacidity could be it. What does yoga do? How does yoga help? First thing is posture. So if your posture is good, that means you have straight and upright back. Your abdominal organs have more space and room to do their function properly. When you're slouching and your abdominal organs, you can see they're compressed. You're compressing them so they cannot function properly. So the first thing is posture. And during the session, we will talk more about how yoga benefits our digestive health. So sit with your spine upright and straight. Shoulders rounded back. Don't have hunchback. Try to push your shoulders behind. And as your shoulder blades are moved towards the back, you feel that now you have wider thoracic cavity can expand. All right. So earlier you saw the slide that showed all the different 10 postures and the breath work that we'll be doing. So all of that is geared to keep our digestive system, our gastrointestinal tract in order and healthy. So first thing, let's begin. You're going to stand up. So just go ahead and stand up. And we will start with palm tree pose. Palm tree was the first one in the slide you saw. That is Urdhva Tadasana. And it is really powerful for stretching the colon. So your digestive system and your abdominal organs. So what you will do, your feet are shoulder width apart, interlock your hands, flip them, lift them up, and breathe in. And as you breathe out, stand on your tippy toes. Feel that full stretch of your body. You can, if your elbows are slightly bent, that's okay. If you can straighten your elbows all the way, you can do that. Five, 4, 3, 2, 1, and relax. Very good to do in the morning. So in the morning, you get up, and one thing you do to improve your digestion is drink water from a copper cup. I've got a copper cup here. It's got a little bit oxidized here, but a copper cup. Put some water in it, leave it overnight, and then in the morning, first thing, drink water from here. It could be half a cup, whatever you're comfortable with. And if you don't have a copper cup and you don't want to go out to buy one, well, you can use pennies. So use any cup, wash some pennies, copper pennies, right? So put those pennies in it, fill it with some water, and then drink the water. Don't drink the pennies. All right. That's another way to do that. What it does, it helps with the gastrocolic reflex action in the morning when you're doing this. Now we'll do Tiryak Tadasana. That is the swaying palm tree. So again, interlock your hands, flip your hands, lift it up, breathe in, and now turn to the right, come back to the center, and then turn to the left and come back to the center. Again, let's do it one more time. Breathe in and to the right, come back to the center and to the left, come back to the center. Keep your arms stretched and then slowly bring your hands down. Very good. So that is Tiryak Tadasana, swaying palm tree. So that's number 2 in our list. Number 3 is the spinal twist, Kati Chakrasana. What does it do? It also works on stimulating our intestines, our small intestine, large intestine, and our other abdominal organs. So it's pancreas, spleen, liver. These are all organs that help with digestion. So bring both your arms to the front. Your hands are parallel to each other and keep your gaze parallel to your hands. Breathe in. And as you breathe out, turn to the right, turning your torso to the right, all the way to the back. And slowly in the same outgoing breath, bring your hands to the front. Breathe in the center and breathe out to the other side. And slowly bring your hands to the center. Let's do it one more time. Breathe in and breathe out to the right. And slowly bring your hands to the front. Breathe in the center and breathe out to the left. And in the same outgoing breath, bring your hands to the front, drop them down and shake it off, catch your breath. So that was the number 3 in the list of asanas that we had shown earlier. So that is the spinal twist, Kati Chakrasana. Next, we'll do Trikonasana. Again, remember, how yoga helps us is through this gentle massage, and it puts a little gentle pressure in our abdominal organs. So our stomach, liver, pancreas, spleen, that's how it is. It stimulates those organs. So now for triangle pose, spread your legs about 3 feet wide. Spread your arms at the shoulder level. Great. Now turn your right foot to the right. Look on the right side. Breathe in. And as you breathe out, slowly you're going to turn down to reach your right ankle. You're bending towards the right ankle. If your hand doesn't reach the ankle, that's okay. Your left hand is pointing towards the ceiling. If your hand just reaches here, you stay here. If your hand reaches here, you stay here. It is the cultivation of effort that is what matters. So you're going to slide it down. Stay wherever you can. 5, 4, 3, 2, 1, and relax. Slowly bring your hands to the shoulder level, drop them down, catch your breath, and point your foot forward. We do the same thing on the other side. Again, spread your arms at the shoulder level. Turn your left foot to the left. Look on the left side. Breathe in. And as you breathe out, slowly bend down to reach your left ankle with your left hand while your right hand is pointing towards the ceiling. Now, if you have any neck problems and you cannot tilt your head or turn your head towards the ceiling, you can look straight in front or you can even look down, whatever is comfortable. 5, 4, 3, 2, 1, and relax. Slowly bring your hands to the shoulder level, drop them down, turn your left foot pointing front. So if you're wondering how many times to do, so in the morning when you're doing this or whenever you're doing yoga, you do it for a round of 3 breaths or 5 breaths. You start with 3 breaths, slowly work your way up. Okay? And it helps to stay in a posture for at least a round of 3 breaths, because then you're giving it more stability and you're allowing your body to get the maximum benefit of the posture. So that was triangle pose. So come back. And now we will do the tree pose. That is the balancing posture. So for Vrikshasana, we have done this before. So put your hands at the waist level with your fingers pointing behind and your thumb is pointing to the front. Now put your left foot forward. Then see if you can lift your left foot up. And if you feel that you're wobbly or you're losing your balance, then quickly put your toes down, your left toe down for support. So whatever is comfortable. So you start with this. You can even roll your foot around, then do it in the opposite direction. This is a variation of a balancing posture, and then slowly bring your foot down. So this is a modified version of Vrikshasana, of tree pose. Let's do the same thing on the other side. So now your right leg is forward. Lift your right heel up. And then you can even lift your foot up. And just stay there. And slowly move your right foot. Very good. And then do it in the opposite direction. Great balance. Slowly bring your foot down and relax. Catch your breath. That's the standing postures. And now you're going to sit down, and we will sit down in Vajrasana, thunderbolt pose. So the way you do that, you might need a pillow. So I have shown you before. So if you have a pillow, you can do that by putting the pillow on the mat and then resting your shins on the pillow and then bending like this. So you can either do that, or you can bring another bolster, put it here in above your legs, and one pillow below your legs, whatever is comfortable to you. So you're going to just sit here like this, and then this is Vajrasana. Your hips are sitting in between your feet. We have done this before, I have shown you here. So you can see your hips are resting in between your feet. Your heels are pointing outward. So either that, or you could be like this, whatever is comfortable. This is very good for digestion, Vajrasana. You will find a lot of people in India after they have had a heavy meal, and this posture you can do after a heavy meal. So after they have had a heavy meal, they just sit down like this, and this helps with their digestive process. And keep your spine upright and straight. Thunderbolt pose. Okay, that is Vajrasana. Now you're going to raise both your arms up. Breathe in. And as you breathe out, you're going to bend forward, keeping your head between your arms. So you're going to slowly bend down. Then rest your elbows on the mat. And you can bring your forehead down to the mat. Now, if your forehead is not reaching the mat and it just stays up here, that's okay, stay up there. Wherever your body allows, whatever is the comfort level of your body. So you do it according to the capacity of your body. Now keep breathing. You'll feel the pressure in your belly. And this is how you are massaging your internal organs and stimulating, especially your digestive organs, your abdominal organs. 5, 4, 3, 2, 1. And as you lift your head up, keep your head between your arms while lifting it up. Okay? Because we have a tendency sometimes, when you're lifting it up, your head is up here and your arms are below, and then you are lifting yourself up. So try to do so. As you're doing it, you're going to lift your head in between your arms, and then you bring your hands down. Okay, very good. Now that was called hair pose, Shashankasana, what we just did. Now we will do frog pose, Mandukasana. This is also in that list. So the way you do that is you're going to bring your hands in front and then drop your fingers down and make a fist with your thumb inside. So it's like this. So your knuckles are together. Put it at your belly button and push your belly in, breathe in. And as you breathe out, you're going to bend forward. Keep your head straight. Try not to bend your neck so that your spine is upright and it is actually, the spine remains straight. You're not bending it. So you stay here. You're not bending your neck. Feel the pressure in your belly. 5, 4, 3, 2, 1, and relax. Powerful asana, Mandukasana, to activate our digestive fire. Digestive fire is the Jathar Agni. In yoga, we call it Jathar Agni. Jathar Agni is the metabolic energy of digestion. So your body is like a food processor. I am not like a food processor, it is a food processor. We are processing food. So, when we put some food in our mouth, the digestive process begins right here. Chewing with the saliva. So the teeth are doing the job of a chopper. Chop, chop, chop. Chew, chew, chew. The more you chew, the easier it is on the blades of the food processor. What are the blades? The blades are the Jathar Agni. That is the metabolic energy, like I mentioned. So, and this is the whole GI tract, is your esophagus, your stomach, your intestine, small intestine, large intestine, and rectum. So, chew, chew, chew. The more we chew, the better it is for our food processor. Remember the blades here, that is the digestive fire. So what we just did, we are activating that digestive fire. Yogis, they say they can eat anything because they know they have a strong digestive fire, so they will digest it. That's what we want to be like. We want to have that strong digestive fire. All right. So now we just did the frog pose. We can also do balasana, the child pose. So that you raise your arms up, you're going to slowly bend down and then bring your hands towards your feet. You're all curled up. Feel the pressure in your belly. 5, 4, 3, 2, 1, and relax. Slowly come back up. Okay, very good. Now relax. Stretch your legs. So we have a lot of food processors here today, virtual food processors, all of us, and we're working on activating our Jathar Agni. Remember the blades of the food processor, that is our Jathar Agni. So what does yoga do? It stimulates this digestive fire to improve metabolism. All right, now put your hands behind, keep your spine upright and straight, and now we are going to do those light exercises. So, starting with the feet, wiggle your toes, wiggle, 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 move them, curl them into inwards, and then point it towards the body. Breathe in away from the body and breathe out towards the body. So whatever you're comfortable. Basically, before a movement, you breathe in because you need that extra energy of oxygen to give to the muscles in order to move. Now, point your feet towards the body and point them away from the body. So as you point your feet towards the body, your heels are pushed outward. You can feel that stretch. Push the heels out and feel that stretch on the lower side of the legs. And away from the body, roll it around. And now, press your kneecaps down, feel the tightness in your knees, hold it tight, press the knees down, keep holding it, and relax, shake it off. Very good. And now we'll do Chakki Chalanasana. This is recommended for improving and increasing our digestive fire as well as improving our digestion. So if you have problems with constipation or indigestion, you do this. So you're going to keep your spine straight, interlock your hands, keep your arms straight, don't bend your elbows. Keep them straight, breathe in and move back and bring, so you're moving your hands in a circular motion. Okay, breathe in. As you go back, breathe out to the front. Great. You want to have a strong digestive system. Now remember, Dr. Sarkar always says the 3 indicators of good health. Take the last round in this direction and then do counterclockwise direction. So the 3 indicators of good health are strong digestion, easy elimination, and good night's sleep. Strong digestion, easy elimination, good night's sleep. It sounds very simple. Actually, the health is very simple. If we keep maintaining it and we don't mess it up with our lifestyle choices that we make sometimes. So, it's simple yet very profound and very effective. Strong digestion, easy elimination, good night's sleep. So, what we are doing just now, this is for strong digestion, for improving our digestive fire. So that was Chakki Chalanasana. Now, fold your leg, bring it over your left thigh. Take the fingers of your left hand in and put them in between the toes of your right foot and shake, shake, shake gently and slowly roll it around. Then do it in the opposite direction. It's very relaxing. It feels really great. Improves varicose veins issues. Now remove your hands and tap, tap, tap with both your hands. And then make a yogic fist with your thumb inside. Move your knuckles all over your foot. Tap gently. And then move it, sliding it. You're stimulating blood circulation. And you already press with your big toe, little toes, and your entire foot. With both your hands, you are pressing your foot, giving yourself a nice pedicure, relax. And then you can lift it up like a child. You're holding this folded leg with both your hands and just rock it side to side. Moving it side to side. Left to right, right to left. And relax. Stretch your leg. Shake it off. Catch your breath. Hold your other leg. Rest it over your right thigh. Take the fingers of your right hand. Put them in between the toes of your left foot and shake, shake, shake. Move it slowly, roll it around. So Hippocrates, the father of modern medicine, says bad digestion is the root of all evil. He's talking about with respect to health. Bad digestion is the root of all evil. What do we say in yoga, in Ayurveda? We say that healthy digestive system is the basis of our well-being. Healthy digestive system is the basis of our well-being. Do it in the opposite direction. So, in the yogic science, they say that more than 90% of the diseases, they all begin with our gut, with our digestive system. And they give us a lot of signals for a number of years before it becomes a chronic health issue. Number of signals. So if you address it right away, you take care of majority of health issues. Now take both your hands, tap, 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 both your foot, and then massage your big toe, your little toes. Then make a yogic fist with your thumb inside and slide your knuckles all over the sole of your foot. Then tap, tap, tap gently. And relax. So you've already given it a good massage. Now lift it like a baby, rocking it side to side. So these movements, they affect fascia, especially the movements that we don't normally do. So this is kind of a lateral movement you're doing for your pelvic joint. And then relax. Stretch your leg, shake it off, catch your breath. Very good. Okay, now you can fold both your legs, bring the soles of your feet together, interlock your hands, put them under your toes, and now flap your knees up and down. This is butterfly pose. This is called also Bhadra Konasana, butterfly pose or Titli Asana. So the folded legs are like the wings of a butterfly. You're flapping them up and down gently. Very nice. And it feels really good because you can feel the stretch in your hamstring, your quads, and just relax. And initially you will notice your knees are up here, which is fine, just stay there. But with practice, you will notice that your knees go down all the way to the floor. Just a matter of sustained regular practice. Okay. Now relax. And with all these movements, what are we doing? We are also stimulating blood circulation. And when you stimulate blood circulation, you're also improving your digestion. Okay, now bring your arms to the front, spread your fingers wide open, and then make a tight yogic fist with your thumb inside. Open and fold. So it is this contraction and expansion that helps your joints. Then raise your hand up, straight, down, straight, up. So this is extension, hyperextension, and flexion. Very, very good for the wrist joint. Now flip your hands, make a yogic fist, and roll your fists around. Keep your spine straight. Then do it in the opposite direction. Very good. Open your hands and touch your shoulders. Just do it a couple of times, then do it sideways. Remember never to take pain medication before doing yoga, because then you won't know what your threshold is. And you can hurt yourself and yet not know it at that time, but it will pain later on. And at no point should you experience pain while doing yoga. Drop your elbows down and roll it around. Why? Because you know your capacity. So just listen to your body. And then do it in the opposite direction. Keep doing your yogic breathing. Let your out breath be longer than your in breath. Shake it off, relax, catch your breath. Very good. Now raise your right hand as if you're telling someone to stop. So your palm is up, and then take your left hand and slowly pull your fingers towards the body. You feel the stretch on the wrist joint. And relax. Now drop your hand down, and now pull your fingers towards the body with your other hand. Feel the stretch on your wrist joint and relax. You can even point it to the right side and take your hands to the right, to the fingers, and pull it towards the body. Feel that stretch on your wrist joint and relax. You can do it the other way. And let go. Shake it off. Catch your breath. Do the same thing with your left hand. So again, pull the fingers towards the body, you're pushing it, and relax. Drop your hand down and slowly hold your fingers and slowly, gently bring it towards the body and let go. Point your hand towards the left and do it in the left direction and then on the right side. So that you have addressed it from all the different sides, all the different angles, let go. And then just move. It's like you're playing a piano, an invisible piano, so move all your fingers. Especially as we grow older, you know, we tend to have this trigger finger, or, you know, some arthritis can kick in. Then drop your two middle finger and ring finger down and feel that stretch. You know, it's like how you say, like, I'm feeling cool, I'm cool, that kind of a thing, right? Feel good. You will do it and it feels really great. Now relax, let go, shake it off. Catch your breath. Very good. Now interlock your hands and lift it up. Feel that stretch on your spine. Try to keep your arms straight so that the upper arms are touching your ears. But if you feel that you are unable to do it, you need to bend your elbow, you can do that. Whatever is comfortable, you know your body's capacity. 5, 4, 3, 2, 1, and relax. That stretch is good. You know, all the intestinal organs and your abdominal organs, they're all feeling that stretch when you do that. Okay, creating more space for them to really function well. Very good. Now, we will do the neck movement for the neck joint. So, breathe in and gently drop your chin down. Feel the stretch on the back of your neck. Slowly lift your chin up and gently drop your head back. Feel the stretch on the front part of your neck. Now relax, bring your head to the center and tilt your head to the right. So no need to raise your shoulders. Keep your shoulders at the normal level. Just simply drop, turn your head to the right. So your right ear is closer to the right shoulder. Bring your head to the center. Breathe in the center. And drop your head to the other side. So now your left ear is closer to your left shoulder. Feel the stretch on the right side of your neck. Now relax, bring your head to the center and turn your head to the right. And slowly bring your head to the center. Now turn your head to the left. And bring your head to the center. Now we are going to roll our head around. Do it very gently. Always do it while sitting down. And if it pains, you need to back off, okay? So breathe in. And slowly drop your chin down and roll your head around very gently. And keep doing your normal breathing as you roll your head around. Because there are major arteries and veins and vagus nerve going through our neck, it is very important that you do it while sitting down. Okay, roll it in the opposite direction, in the counterclockwise direction. And never do it while standing up. It can bring an altered sense of consciousness. Also, don't do it when you are driving. Don't think that, oh, I'm sitting down while I'm driving, so why don't I just do it while driving? Not a good idea. All right. So this is the routine that we have put together for digestion, and you will see that slide at the end that shows, you know, that's your takeaway from the session, the 10 asanas and the pranayams. Now we are going to do the supine position postures. So for that, you're going to turn sideways and lie down on the mat, on your back. So actually, you know what, I just thought, why not do a Naukasana, boat pose? I think that's a good one too for improving your digestion. So as you're sitting here, spread your arms in front of you, and this is like you are like a teddy bear, right? You're sitting like this, arms stretched, legs are stretched. Slowly you're going to lean back, keep your arms straight, and see if you can slowly lift one leg up. And if you are comfortable, you can lift both legs up, or you can just do it with one leg at a time, whatever is comfortable, and stay there. So your body is hinged on your hips. Your legs are up, your upper body is up, your arms are stretched. So now you will notice that your head, hands, and feet are at the same level. And you feel a lot of pressure in your belly. So 5, 4, 3, 2, 1, and relax. Slowly lie down. And now just catch your breath. And now we will do supine postures. And again, these are geared for improving our digestion. So we will start with the full body stretch. So point your toes away from the body. Raise your arms and drop them down behind you. And feel the full stretch of your body from the feet up to your head. 5, 4, 3, 2, 1, and relax. Bring your hands back down. Come back to start position. Next, we will do Pavan Muktasan, the knee chest pose. This is really good for flatulence, acid reflux, indigestion, constipation. So here, fold both your legs, bringing your feet close to your hips. Then you're going to lift your feet up, wrap your arms tightly around your folded legs, hold them tightly against your body, and you'll feel the pressure on your belly as you do that. So hold it tight, keep holding it. Now if you don't have any back problem, you can do this. You can lift your head up, you're raising your head towards your knees. So you're all curled up like a ball. You feel the pressure in your belly. 5, 4, 3, 2, 1, and relax. Let go. Come back to start position, which is both your legs together, feet pointing up, both your arms are next to the body, palms facing down. So next we will do Padvrittakarasana, the leg rotation. So again, what we will be doing here, we will be lifting our legs up and rolling them around, like making it in a circle, an imaginary circle that we will do. So let's see, let's get ready. So put your hands under your hips. That gives a little extra push to the lower half of the body. Then you're going to raise your legs up. And slowly you're going to roll them around, draw like a circle. Do it 3 times in one direction and do 3 times in the counterclockwise direction. Slowly, mindfully, you're not in a rush, take your time. And if you need to do it with one leg, feel free, do it with just one leg. You get the same benefit. When you do it with one leg or when you're doing it with both legs, then do it in the opposite direction, in the counterclockwise direction. And when you finish your round, come back to start position. Keep your hands under your hips. We'll be doing one more posture that requires our hands under our hips. So catch your breath, and now we get ready to do the bicycle pose, but that is called Dvichakrikasana. Fold both your legs, bringing your feet close to your hips. Then lift your feet and pretend you're riding a bicycle. So you're pedaling the wheels and you're alternately moving your legs in a full circle. Do it slowly and mindfully. Don't rush. You're not in a rush to go anywhere. So you don't have to ride your bicycle too fast. Take your time riding your bicycle. Now do it in the opposite direction, in the reverse gear. Last round. And catch your breath. Come back to start position. You can remove your hands from under your hips. Now, the next posture that we are doing is called the Markatasana, and it is also called, it's a twisted spinal twist. It's Markatasana or Jathar Parivartanasana. So you're going to fold both your legs. Spread your arms at the shoulder level, drop both your knees to the right, and turn your head to the left. So now, your right leg is on the floor, your left leg is sitting on top of your right folded leg. So your left foot is on top of your right foot, and your left knee is on top of your right knee, and your head is turned in the opposite direction, away from the knees. And you feel the stretch on the left side of your torso. And relax. Bring your knees to the center. Bring your head to the center. Catch your breath. Then we'll do the same thing on the other side. Breathe in and breathe out. Drop your knees to the left and turn your head to the right. So now you feel the stretch on the right side of your torso. Your left foot is on the floor, your left knee is on the floor, your right foot is sitting on top of your left foot, your right knee is sitting on top of your left knee. And you feel the stretch on the right side. Now slowly relax. Bring your knees and head to the center, stretch your legs. And we will do another variation of this. Now you're going to fold your left leg. Your right leg is straight, folding your left leg. Cross it over your right leg. So, and it's sitting on the floor. And now you're going to slowly turn to the right side. And your left hand, you're going to hold your lower back for support. And you feel that stretch now on the right side. This is called also Udar Darshan Asana. Very good for digestion. 5, 4, 3, 2, 1, relax. Bring your leg back to the start position. And now we will do the same thing on the other side. So again, you're going to fold your right leg, your arms are stretched, fold your right leg. Then lift your right foot and cross it over and put it on the other side of your left leg. Got it? And now you're going to slowly turn to your left side and bring your hands to your back for support. And turn your head to the right. So your head is in the opposite direction from where your leg is crossing over, right? So since your right leg is crossed over, your head is in the opposite direction. 5, 4, 3, 2, 1, and relax. Catch your breath. So that was Udar Karshanasana. Udar Karshanasana, powerful spinal twist also. And that's all the postures. You're going to turn to your right side and slowly roll over on your belly. Now, if you have high blood pressure or if you have any cardiovascular issues and you're not comfortable in a prone position, don't do it. Otherwise, do it slowly, mindfully, and you can always back off. All right. So in this posture, we will do Tiryak Bhujangasana. All right, so here the start position is that your forehead is resting on the mat, your feet are together, your toes are pointing away from the body, and both your hands are facing down next to your ears. This is the prone position. So you're going to bring your hands a little bit closer towards your shoulder. Spread your fingers of your hand. Bring shoulder width distance between your legs. Pressing the mat down, you're going to lift your head, neck, chest up to your belly button. Keep your elbows slightly bent. So this is our Bhujangasana. Now breathe in. And as you breathe out, turn your head towards your left shoulder. You're kind of looking over your left shoulder. 5, 4, 3, 2, 1. And relax. This is called Twisted Cobra. Tiryak Bhujangasana. Catch your breath. Breathe in. And as you breathe out, slowly turn your head towards the right shoulder, looking over your right shoulder now. 5, 4, 3, 2, 1, and relax. Slowly come back down to the start position. Catch your breath. And you can turn to your left side and then you can sit up. So that was Twisted Cobra, Tiryak Bhujangasana. So the sequence that we are doing today, some of the asanas in the sequence, they form what is called Shankh Prakshalan Kriya. What is Shankh Prakshalan? Shankh is a conch shell, you know, that we blow. So conch shell. And Prakshalan is the movement. So Shankha is like representative. It's a representation of our digestive system. You know, our intestines are all twisted and turned, just like a Shankh. When a Shankh has a lot of gunk inside and you try to blow, the sound doesn't come out. So it all needs to be empty. Cleansing. So Shankh Prakshalan, what it does, it cleanses our GI tract, our digestive system. It helps with that. So the postures that are involved in Shankh Prakshalan actually is a very elaborate process where you also drink a lot of water and you have to empty out your, do bowel movement. But here you have to do certain postures. So there are 5 of them and we are doing all of them today. We have done that during that sequence. Very good. So now it is time for us to do some breath work. We have done body work, so now we do breath work. And like I said earlier, so the asanas, they help with the stimulation of our digestive organs. But breath work is the major part that also helps with activating of that Jataragni. So we will start with what is called the Kapalbhati Pranayam, the forceful exhalation. This is also called fire breath or breath of fire, Kapalbhati or forehead shining, they're different names. So keep your spine upright and straight. You can sit against a wall to remind you to keep your spine straight. Hands in Dhyan Mudra position, which is index fingertip joined with your thumb tip. And just do a forceful exhalation and do it 1 per 5 seconds. People with cardiovascular issues or with hypertension, they can do it slowly, and if they're not comfortable, then just do deep breathing. And the only part that moves is your belly. This whole system, digestive system and GI tract is all about our belly. We want a happy belly. How can we have a happy belly? through these pranayams and breath work, and and do mindful eating. So it's important what we put in this food processor. Like I said earlier, what goes in here, that makes a difference. But remember, you are what you digest, not necessarily what you eat. So keep doing it. Here you are activating this digestive fire. The digestive fire consists of, like I said, enzymes and bile juice, digestive juices, hormones, all of that. That is the blades. Those are the blades of this food processor. And you're sharpening those blades. So keep doing it. And relax. So here, we did it for maybe 2 minutes or 3 minutes. Recommended time is start with 5 minutes, and then you can work your way up, and you will feel it for yourself. And especially if you give yourself at least 4 weeks time. You do it every day for 4 weeks. It's like you have to reach a threshold. So then you actually start seeing the effects. So you have to do that sustained regular practice. There's a very interesting research article came out in a British journal that talks about how on average it takes 66 days for an activity to become a habit. That is on average. For some people it can be just 3 weeks or 2 weeks. For some people it can be much longer. But it needs some certain critical amount of time to reach that threshold. And the threshold level varies from individual to individual. All right. So that was Kapalbhati Pranayam. Next we will do Agnisar Pranayam. Agnisar is also, it's a digestive fire breath. And this is where you are going to again breathe in first. And then when you breathe out completely and hold. And then move your belly in and out. Do it 5 times. And relax. And now you can breathe. So we are breathing in, then we are breathing out. And when we breathe out completely, that is called Vayamukh, where you have just exhaled. And then you are holding your belly button in. It's like you are holding your navel in and out, in and out. You can even start with 3 rounds. Then when you're comfortable, do 5. Then you're comfortable, you can do 7. You can do 10, 15, 20, 30. Is how long you can hold that breath. So again, let's do it. Breathe in. Now breathe out completely. And now hold it. And do your belly in and out. Of course, you can't see right now very clearly what's happening here in the belly. But you can see it on YouTube videos. There you can see a lot of people demonstrating. It's like a wave. Your belly forms a wave. It's going in and out, in and out. And then you relax. And we'll do one last round. Agnisar Pranayam. It's in that list. You'll see it in the PowerPoint slide. You can always YouTube and Google and see how it's done. So again, breathe in. Breathe out completely. And let's do in and out. And relax. And when you're doing this in and out, you're not breathing in or breathing out. Okay? Very good. So that was breath of fire. Oh, sorry, that was digestive fire breath called Agnisar Pranayam. So relax. Now we're going to do our full body relaxation because we need to be relaxed, for bowel movement, when you're going for, when you're having issues with digestion. A lot of times the tightness, there's too much tightness in the body. So we need to learn to relax. And when we relax, our, organs, internal organs, our digestive organs, they all relax. So that is called relaxation relaxation response. That is a person's ability to encourage the body to release chemicals and brain signals that make our muscles and our internal organs relax. So this is our time for relaxation, recuperation, and recovery, and just it's restoring health. So it's restorative yoga, or you can call it whatever, restorative yoga. When the body is not relaxed, what happens? The blood pressure goes up, your heart rate goes up, your digestive functioning goes down, and your hormonal levels are disturbed. So to bring it all in harmony, all you have to do is relax. Very simple. It's all in the head. Okay. So now let's do yogic yoga nidra, full body relaxation. So lie down. Drop your feet down. Curl your toes inward. Feel the tightness in your feet. Then open your toes and push the balls of your feet outward. Feel that stretch in your feet and relax. Let go. It is through this contraction and expansion of muscles that you actually bring in relaxation in the body. Now press your kneecaps down, feel the tightness in both your legs, hold it tight, hold it, and let go. Relax. Pull your hips in, feel the tightness in your pelvic floor, hold it tight, 5, 4, 3, 2, 1, and relax. Let go. Arch your back off the mat, then drop it down. Hold your belly in, as if your belly button is trying to reach the spine. Keep holding it and relax. Clench your hands into tight yogic fists and press your elbows down, your hands down. Feel the tightness in both your arms. Hold it tight. 5, 4, 3, 2, 1. Relax. Move your head from side to side, left to right, right to left, then let it wobble. Scrunch your facial muscles, pull them all in towards the center of the face as if you are frowning. And then relax your facial muscles, raise your eyebrows towards your hairline. And open your mouth wide. Drop your lower jaw down. And relax. Let go. Curl your lips as if you're ready to whistle. Then stretch your lips from ear to ear, bringing a smile on your face. And now you're totally relaxed. You may not feel any heaviness. You feel like there's total lightness of the body. Slowly turn to your right side. And just stay here for a few seconds. And then you can sit up. And as you sit up, you're just going to stay with this sense of relaxation, this sense of lightness, this presence that you feel now is always there. This presence has no shape, no color, so it's shapeless, colorless, formless. Let the traffic of thoughts come and go. Let the sensations come and go. The thoughts of memories, anxieties, worries about future, they come and go. The presence remains as is. Anytime you notice you're getting too agitated or disturbed, bring your attention to this space of stillness, this presence, and you will just feel a sense of joy. And this joy is our inner nature. This is who we are. This love, peace, harmony, compassion, tranquility. I'll end with this small prayer. May all beings be happy. May all be free from illness. May all see goodness. May no one suffer. Peace. Bring your hands together, rub your hands. Feel the warmth in your hands. Now slowly massage your head, your face. So, as we said earlier, that you are not what you eat, you are what you digest. And so remember that.
Or what? Do you want me to make any?
Sure. Well, with respect to today's session, you can probably talk a little bit about ama, the toxins that you were talked about, improper digestion.
Okay.
And the sapta dhatu.
Okay. So what Abha is asking is that the food in yoga is regarded as we are what we digest. So the whole West we talk about we are what we eat. In yoga it says no, there's nothing to do with what you eat. You need to digest. And in the digestion in yoga is the process called a parasympathetic activation. Like the term we use for a sympathetic tone is called fright and flight, and parasympathetic is called calm and digest. So whole digestion is parasympathetic. Food is not the calorie in yoga and Ayurveda. Both are the same science, same philosophy. The food in proper digestion, and the digestion is also done through your 5 senses and your proper body-mind union. It converts into 7 tissues. In yoga, it's called a dhatu. First is called a plasma, rasha dhatu. Then red blood cell, rakta dhatu. Muscle is called mamsa dhatu. Fat is called medo dhatu. Bones and joints called osti dhatu. Nervous tissue called majja dhatu. Reproductive tissue is called shukra dhatu. After the digestion, they produce a substance, it's called ojas. Ojas is the cellular immunity. There are 3 terms in yoga and Ayurveda, is that prana, teja, ojas. Prana is a cellular communication, tejas is a cellular intelligence, and ojas is a cellular immunity. So all the immunity we talk about is from within. It's called healing from within. In yoga, the immunity doesn't come from outside. That I'm eating this, taking this, it all from creation of the ojas and after proper digestion. What Abha was asking is that if the digestion system is not proper, and the digestion is done through a digestive fire in our body, it's called Agni. And if the digestion is not proper, it produces a toxic substance called ama, A-M-A. A like an apple, M like a Mary, A like an apple, ama. Ama then goes to our channels, and the channels get blocked. So our life force, which is called prana, does not flow properly. And prana is a subtle energy which is brought in our body through our breath. Breath is not the prana. So pranayam, with the breathing, voluntary regulation of our breathing is called pranayama. Prana is the subtle energy, yama is the control and restraint. So in a yogic tradition, the prana has to flow through our body evenly to keep us healthy. If prana cannot flow properly, we have developed a disease. And health is defined as a prana moving freely through our body. Teja is the fire within our body. Teja is glowing, and oja is the immunity is growing. So what Abha did the practice today is basically called activation of this digestive fire. It's called a Jatharagni, and activation of parasympathetic tone. So in total contrast of the idea of Western medical science is that food is a calorie, and you need to burn the food, burn the calorie. But when you want to burn it, when you're exercising it, it's creating a sympathetic overdrive. In fact, that food is not properly digested, and that toxin in our Western medical term is our high blood sugar, high cholesterol, high uric acid. So we have seen people who are doing a daily practice of yoga who activates the parasympathetic tone, the cholesterol level comes down, the blood sugar comes down, all the blood chemistry becomes normal. So it's very important in whole yogic system that the primary health comes from your digestion. So the practice you did today, it is the practice you need to incorporate in your daily lifestyle. Any comments, any questions? I see Malini here. Hi Malini, how are you? Abha, do you see anybody else? I don't see, where is your gallery view? Shared the screen, no.
I think the videos are turned off, so we don't see some people or.
Okay, that's good.
Anything, yeah, I see Charlotte there.
I see Linda there too.
And Linda Robinson is there, yeah. I see Malini.
But everybody's mute, you know. I see Ravi, Sudha, Poonam.
Hi Abba, this is Balakumar.
Oh, hi Bala, where are you? Let me see. Oh, okay. I see you now.
I have a question. Is there any connection between obese and digestion?
Mm-hmm. Extremely. So if you look at the tissues, what it is that there are, see, before that, there are two kinds of obesity, you know, both yoga and, you know, Western medicine. One is overall general called subcutaneous fat. We have a fat all over our body underneath the skin. And next one is called a truncal obesity. We have, everybody has a little bit of a pouch in the middle, but that fat is inside our abdominal cavity. It's called omental fat. So as you noticed, the food, when get properly digested, it goes into the 7 tissues. The first one is called Rashadhatu, plasma, then Raktodhatu, blood, Mamsodhatu is a muscle, Medodhatu, fat, then comes Ostidhatu, is your bones and joints. And these are all being processed through a yogic concept is called Agni. Agni is your digestive fire, digestive process. If that Agni is low, if Agni is not strong, then the food comes and stops at the level of the fatty tissue and does not progress anymore. So the obesity primarily in yogic and Ayurvedic concept is called Manda Agni. That is a low Agni. You need to ignite your Agni. And all the practices today Abha did was basically to ignite that Agni. Is called Agni Dipana. And the way the yoga talks about, if you get Agni Dipana, then it's called Ama Pachana. Ama means your toxin gets destroyed. Nadi Shodhana, the channel gets cleared. And Ojo Sthapana, Ojo is your immunity, gets established. On the other hand, the truncal obesity, the fat inside your abdomen, that is due to the effect of called a cortisol. What is a cortisol? The cortisol is a hormone which is secreted from your stress. When you have a stress, it's called a steroid. Our extra food, whatever the food is not properly digested, body stores it as a fat inside our abdomen. That fat starts acting like a inflammatory tissue. It creates inflammation. That inflammation causes your diabetes, obesity, hypertension, and heart disease. So therapy in that situation is controlling your stress. That is, we call it a quieting down your mind, like your alternate nostril breathing, your bumblebee breathing, Bhramri pranayam, Anulom Vilom pranayam. You will be doing the neck rotation called Brahma Mudra with the Bhramri pranayam. So controlling the stress is a therapy for your truncal obesity, and igniting your Agni, Jathar Agni, is a treatment for your overall gross obesity. Good question. Definitely there is a connection between obesity and digestion. It's not how much food you eat, it's how you digest that becomes part of our body.
So we have a question by one Mr. Manish who wants to know about upper back pain session. Dr. Sarkar, have you done a session on upper back pain, or do you have a video recording of that you can send to him?
Yes, the upper back pain, and mostly see when the back pain is first is called cervical area, called cervical radiculopathy. Then it's called a thoracic area in the chest area. Then it's called a lumbar area, called a lumbar radiculopathy and thoracic radiculopathy. Most of the upper part of the back pain in the neck, the therapy is called the one Abha does almost every day. It's called Shukha, the relaxing asanas. Primarily the hands is called the Bala Mushti Mudra, like a child's mudra. Then you do a shoulder, like a shoulder relaxation. Very interesting is that people like a Western mind, they always want to concentrate where the problem is. The problem is not there. Problem is overall. It's called a global. Then you do your slow shoulder relaxation. Then your neck relaxation. It's called your Brahma Mudra, then called Paschim Namaskar. Put your hand. All of them are in my videos. In fact, any of the videos you pick up on my YouTube channel, at the beginning, I do the same practice. And Linda is here. She can nod her head. Every class we do, we start with that, and that is our therapy for our back pain. And the lower back pain is very, very simple. We do it all the time, and Abha has done it multiple times, and she will probably do it again one more time. Thank you for the question. Anything else? It's a good time, we see each other this way. Malini is very silent, Malini is listening.
No, Malini, we cannot hear you.
Unmuted.
She's talking, but we cannot hear. I think she needs to unmute.
Linda, do you have anything? Any comments? Any question, Linda?
It was a very good class. I enjoyed it, and very good class.
So when are you going to give a class to us? We want to have a class from you. We are waiting for it.
Thank you, Linda, for joining.
No, Linda has to give you a class,
Yes.
Linda, we want to have a class from you.
I'm taking some time off to work on some other projects right now, but in the future.
In the future, okay. Abha, keep her in the list, okay?
Absolutely, yeah. It's so good to see her. I miss our old Port Cove sessions and miss seeing all these people. But it's good to see you virtually, Linda.
It's good to see you and everyone else.
And Charlotte is here too. Charlotte,
And now, yeah, I see Charlotte.
thank you
And I
for
see
joining.
Malini. Malini, Charlotte, we cannot hear you.
We cannot hear. I cannot talk to you.
I wasn't,
Now,
I
now
was
we can hear.
speaking, but I'm fine.
It's
We-
can I?
We can hear Malini now, you know. So
Yeah, we can hear her now.
I can't.
Now I hear Charlotte, I think.
okay. All the 10 asanas, pranayamas, you all have it here. That's good. Okay.
All right. So thank you so much for joining in, Dr. Sarkar. We really appreciate your time and responding to the questions.
What we'll be doing next session?
Whatever you recommend, what do you suggest?
Up to you. You know, I mean, the
You know, one of the topics
him-
we had talked about was also mental health.
It's good. It ties with your GI. You know, you know, the gastrointestinal system. We call it a second brain, or maybe third brain. You know,
Yes.
we call it a gut feeling. So gut feeling is when you whatever you have done for your digestion and gastrointestinal system, probably everything will tied up with your mental health.
Okay, so we'll do mental health next week.
Okay, that'll be great.
Sorry.
We all need it this time, you know.
Yes, absolutely.
I heard a beautiful comments. We are doing a international yoga festival, and there was a 10-year-old boy from Canada. 10-year-old kid. Think about it. He's doing yoga. Then his comment was, if you keep on doing yoga, your mind is in the yoga, so your mind is not in the coronavirus anymore. So the coronavirus doesn't bother you anymore. It just blew my mind. You know, 10-year-old kid saying, if you do yoga, you don't think about coronavirus anymore. You know? So that will be your ideal way to present. You know.
Yeah, and you know, it is so true, because while we were doing yoga, I mean, that was away from our head. We were not thinking of this pandemic or anything. We were on the mat with our breath and with our movements.
Great. And I had the same issue, you know. I was teaching from my home, and there's a lot of some activities going on, noise was going on, and somebody in college said, yeah, a lot of background noise, something happened, but nothing happened to me. I just kept on just teaching, you know. Your mind gets totally absorbed in the
You probably didn't hear the background noise also.
Exactly. You're absolutely right, you know.
Yeah.
So keep that back of your mind, and then just do a yoga therapy for mental health, you know.
What is your next session on? When are you doing your next session?
My next session will be on a therapeutic pranayama. So we did the last Saturday, we did a therapeutic asana. And primarily, I really targeted a little bit for healthcare providers and also physicians. A lot of physicians joined, and they already called me before. So I kept it a little bit from the medical perspective. And next Saturday, we'll do a therapeutic pranayama for different chronic diseases. Join us, you know, Facebook Live, you know, whoever has a Facebook. I never been to Facebook before now. What is it, Abha? You know, we can do it through Zoom or do it through Facebook.